Breastfeeding and breast milk is more than just nutrition.
The research is there to show how much healthier children are when they're exclusively breastfed.
If you can get through the first 6 months, then the rest of it is, it's a piece of cake. So in step 6, we're supporting mothers to exclusively breastfeed for the first 6 months, unless supplements are medically indicated. Breast milk is made specifically for the human baby. It provides the colostrum, which provides the immunoglobulins from the mum, and the milk production within the woman changes to suit the requirements of the growing infant. As the baby grows, so does the milk supply. So the exclusivity is indicated because it's actually, I guess, best for the baby and best for the mum. If the mum chooses to provide water or diluted juice or any other type of supplement, it can interrupt the breastfeeding. And then the child would be filling up on the juice or the water.
I talked to moms on a practical level. I said, you do not need to start worrying about solids until 6 months of age. Once you decide not to breastfeed, you can't necessarily reverse that decision. And so I want you to make the best decision for you and your baby with the best information that I can give to you. So in a respectful way, try to inform the mom, the dad around the pros and cons.
A good number of our parents were coming in wanting to breastfeed but didn't know how they were going to make that happen and didn't know even the value of exclusive breastfeeding. So again, the education of parents became very important.
The Canadian Pediatric Society and Health Canada recommends that breast milk be the only food or drink your baby needs in the first 6 months of life.
What I remember learning that I found fascinating was how important not only mom's milk is nutritionally to baby, but how important the emotional bond and the physical closeness is while nursing. With breastfeeding in particular, we know that it's so important for baby's health, especially within the first 2 years that they're breastfed.
Again, so being supportive of exclusive breastfeeding to me means, we've taken the magazines that have formula ads in them out of the office. And we have a lot of normalizing posters that we've gotten from either BFI or from public health that show women at all walks of life and with babies of all ages breastfeeding normally in public. We also want their partners, their parents, the grandparents, their siblings who are coming to see their doctor to see these posters and recognize this is normal.
The exclusive breastfeeding, to me, is completely tied into the documentation and the data collection, because you can't really measure exclusive breastfeeding in the measure of tools to measure breastfeeding.
If I had to do it over again, we would start with data collection, because you need to measure what you're doing.
We actually have some concrete examples. I'm not sure if you're familiar with Born, but it's a database that captures mother and baby information across the province. And so through that database, we're able to see what our breastfeeding rates are. From 2013, we've seen an increase in exclusive breastfeeding rates from 60% to this year to a rate of 74.5% of moms and babies who are exclusively breastfeeding from delivery to discharge.
One of the things that we implemented probably 3 or 4 years ago was the request for information about supplementation in the documentation. So when nurses used a supplement, what kind of supplement? Was it express breast milk? Was it donor milk? We have that in our documentation tools. Or was it formula? And if it was formula, was it medically indicated? And if it wasn't medically indicated, why was it used as an option? Things were being requested when supplementation happened. We made it part of a specific policy around supplementation for breastfeeding infants. And within that policy, there were guidelines around volumes and around the discussion and the informed consent piece.
You know, I might make a suggestion that instead of using formula, have you considered pumping your breast and using your milk, and then maybe having that discussion how formula could impact her milk supply. I think really it's about going back to the basics and ensuring mothers understand the supply and demand concept.
Our personal biases need to be checked in order to provide a new mom with the best information for breastfeeding.
An organization's exclusive rates or breastfeeding outcomes are entirely related to what they're willing to invest. We have here an outpatient clinic. We have inpatient lactation consultants. We have lactation consultants designated just to the NICU. We also provide 2 separate classes every day, breastfeeding classes, where an LC and or one of the nurses will teach a breastfeeding class. The commitment is there, and the follow-up it's a very busy clinic, but the follow-up is there for after discharge in terms of supporting breastfeeding. And, you know, we also make sure they know what their community links are in telehealth and whatnot.
Breastfeeding has been the most challenging at times parts of my life, but also the most beautiful part of my life. The bond that is there when mom and baby are nursing together is irreplaceable. And it has just made both Jack and I so healthy, both emotionally and physically. The more we can support moms, especially as an organization, the greater chances we have of supporting healthy communities and creating a positive impact on new moms.